Edward Timpson.
Thank you very much, Madam Deputy Speaker. And as the Prime Minister said earlier, none of us want this, pitting lives against livelihoods, and I would also add the quality of our lives. It's excruciating, it's uncomfortable, and it tugs at our values and sensibilities. But the truth is that it is an invidious conundrum with no good options, as my honourable friend has just said. And we can't escape the fact that these measures that we're voting for this evening will come at a significant cost for many people in our constituencies, including mine of Eddisbury, whether that's social, financial or from a mental health perspective. And I take a particular interest in the impact it has on children, who we know through the first lockdown have had a whole range of new experiences, not all of them good, that may play out for many years to come. So I also welcome the fact that schools will remain open during the next 4 weeks. I think that is incredibly important for a whole range of reasons, and I would urge every parent to do their bit in making sure that their child gets the education and all the other benefits from the schools remaining open. I would ask my right honourable friend, the Minister, just to clarify that if a child is classified as clinically vulnerable, whether they're still expected to go to school, as I've had some queries about that. But we also know that there is the financial damage that this will cause, the scarring of the economy, as it's sometimes known. And I have highlighted, as my right honourable friend will know, and will again in a debate on Monday in Westminster Hall, the wedding industry, as well as pubs, zoos, beauty salons and so on, as we did in the first lockdown. We can't forget that despite the significant package from the Chancellor to support them, that there are still gaps that need to be filled, and they need some hope for the future. But I do understand that the figures, as we can read them, and I would like to see more granular data in the future, are not good to read. Whether that's the number of COVID patients now in hospital and the trajectory that many of our trusts, our hospital trusts, are telling us that they are on. And so we do need to act, and I will be supporting the measures this evening to do that. But I would urge my right honourable friend, as has been mentioned by other members, that we do need to, as part of this, make sure we don't end up in a vicious cycle of lockdowns, which will do more and more damage as we still try and control the virus. So we do need a plan for how we can live with it in the longer term. What we do next to once we've reduced the R number below 1, to keep it there so that we can continue to reopen the economy, but most of all to give Eddisbury residents and businesses the normality, the certainty and the hope that they crave.
Stephen Hammond.